My name is Lindsay Pegg, and I'm a senior communication disorders major at California University of Pennsylvania. I'd like to thank you for attending my presentation today on Pierre-Rubin sequence. So, Pierre-Rubin sequence is a congenital disorder, meaning that it is present at birth. It is also referred to as a sequence. It is in its name, Pierre-Rubin sequence. So, a sequence is when there's a sequence of events that occurs in fetal development that then causes the diagnosis of Pierre-Rubin sequence. And Pierre-Rubin sequence is relatively rare. When we're talking about the incidence, it only occurs in about 1 in 2,000 to 30,000 live births every single year. So that might make you ask, what does Pierre-Rubin sequence look like? So the physical manifestations associated with Pierre-Rubin sequence are a small lower jaw, misplacement of the tongue, a high arched cleft palate, and the malformation of the outer and middle ear. As you would think, these malformations make it difficult for the child to properly breathe, properly eat, and communicate later in life. In order to have a normal life or close to normal life, the patient may need palatal reconstructive surgery, which is surgery of the palatal wall or the roof of the mouth, the insertion of a gastric tube, which is a tube that is inserted directly into the stomach so they can be properly fed, and the insertion of pressure equalizing tubes, which are tubes that go directly into the tympanic membrane or the eardrum to alleviate any pressure from the malformations or the otitis media, which is an ear infection that is very common in Pierre-Rubin sequence patients. After any reconstructive surgery or the insertion of a gastric tube or a PE tube, the patient may still need speech therapy later in life so they can communicate properly. The speech therapist may work on articulatory disorders or resonance disorders, anything that the patient may be having a hard time with. So let's get back to the incidence. Pierre-Rubin sequence is very rare. It only occurs in 1 in 2,000, 30,000 live births every year, so it is relatively rare. This rarity makes the existence of support groups for this disorder extremely important. So this would be important for the patient, the patient's loved ones, and even the clinician, because these support groups offer information, shared experience. It makes the loved ones not feel so alone, and that is very important for the successful recovery of these children. The support groups that I found most relevant were the Birth Defect Research Center for Children. This is relevant because it is congenital disorder. The Cleft Palate Foundation, because one of the markers of Pierre-Rubin sequence is that high arched cleft palate, and the National Association for Rare Disorders because of the rarity. Again, the purpose of the support groups are to make the loved ones not feel so alone, and that's very important. So at the end of my presentation today, I wanted to tell you the purpose of my presentation is to spread awareness of this disorder and make the world a more educated and welcoming place. With that being said, September 5th is Pierre-Rubin Sequence Awareness Day. So maybe if you remember my presentation, you'll be able to tell somebody about it. And again, we can live in a more welcoming, educated place. So thank you so much for listening to my presentation today. I hope you have a good day.